Hello and welcome to another edition of Health Matters. I am your coach. I am your captain today, Dr. Michael Chalemi. So on this episode, what we're going to talk about is a very serious topic that affects millions of people. We're going to call this episode Mind's Maze, Navigating Dementia and Alzheimer's. So we're really going to dive into the labyrinth of dementia and Alzheimer's disease, unpacking the science, exploring what's out there, discovering strategies, understanding the medical side of it, and hopefully I'm going to put it in some terminology that everybody can understand. Some of it's going to be obviously complicated, but hopefully I'll put it into an understanding to really look for the backbone of what it is, right? And have an understanding of some of the anatomy and the functionality. So with that said, I'm going to jump right into it. I'm going to give you let me give you 5 facts that you might not have known about dementia and Alzheimer's. Alzheimer's disease is ranked the 7th leading cause of death in the United States. 7th leading cause of death is from Alzheimer's. That was one of the stats that actually made me sit up in my seat a bit. Alzheimer's disease is the most common form of dementia. It's accounting for 60 to 80% of the dementia cases. Currently, approximately 55 million people worldwide are living with dementia, according to the World Health Organizations. Women are disproportionately affected by Alzheimer's, making up nearly 2/3 of all reported cases. Alzheimer's has no known cure and no medication yet to reverse or cure the disease. It is a disease that you'll see when we go through this that is growing in leaps and bounds, and we as a society need to really look at the landscape and say why, what's changed, how do we slow it down, how do we stop it, fix it, not only for ourselves but for our future children and future generations. Okay, so let's unpack it a little bit. What is dementia? So dementia is not a single disease but a syndrome. It's a collection of symptoms caused by brain disorders that affects memory, thinking, behavior, and overall ability to perform daily activities. Dementia is kind of a term that we will call an umbrella term. And in cases, conditions such as Alzheimer's, vascular dementia, Lewy body dementia, and other forms. And we're going to get into all of that. Alzheimer's disease. So Alzheimer's disease is the most common form of dementia. It accounts for 60 to 80% of all cases. It is a progressive, irreversible condition that affects memory, thinking, language, and other cognitive function. Alzheimer's is characterized by the buildup of abnormal proteins in the brain, amyloid plaque, and tau tangles, leading to the loss of neurons and brain shrinking. So how many people does it affect? I know we said in the beginning, dementia affects roughly 55 million people worldwide. But here's some numbers that are going to get you to sit up in your seat. This number is expected to rise to 78 million by 2030 and to 139 million by 2050 due to the aging population. Those are staggering numbers. So basically what that's telling you is, according to the World Health Organizations, is in 25 years, we are going to triple the amount of dementia in the world. If that doesn't scream to say, hey, we need to figure something out and we need to do it now, I don't know what does. In the United States alone, As of 2023, there was 6.7 million people over 65 living with dementia, with women accounting for 2/3 of this. Okay, so now we understand how many people it's affected and where it's going. And the alarm bells should be going off. Let's understand a little bit about the anatomy of Alzheimer's and dementia, if you really want to look at an understanding. So, normal brain function. Your brain contains billions of nerve cells, neurons that communicate with each other via chemical signals. These neurons control everything from memory to problem solving to breathing and heart rate. What goes wrong with Alzheimer's? So what goes wrong with Alzheimer's is there are proteins like beta amyloid clumps together. Well, so beta amyloid, they clump together to form plaque between the neurons, disrupting communication. Also, you could have abnormal formations of TAO proteins. And when they have abnormal formations, they have something called a TAO tangle. So basically, the inner workings of the cell tangle, and that basically impairs the nutrient transport, leading to cell death. So basically, the inner workings of the cell gets tangled, and basically your wires get crossed. So in simple terms, in the TAO protein, the wires get crossed, and therefore the cells die. Over time, this causes your brain to shrink, particularly the hippocampus, which is critical for memory formation, and the cerebral cortex, which is responsible for thinking and decision making. So let's talk about the brain and dementia. Different types of dementia affects different parts of the brain. So Alzheimer's affects memory and learning and then spreads throughout the brain. Vascular dementia relate to blood flow and oxygen, typically after strokes or clots. Lewy body dementia affects movement and behavior controls centers in the body. So let's briefly talk about how dementia and Alzheimer affects your life. Cognitive changes. So the first thing that they're going to say is this cognitive changes. Progressive memory loss, starting with recent memories and advancing to long-term memories. Difficulty solving problems or carrying out familiar tasks. So basically things you've always done, you forget how to do them. Decline in judgment and planning, right? So you used to be able to go to the store, go to the bank, come back, maybe you forget where the bank is, or you forget where you live. Those type of things. Emotional and behavioral effects, increasing frustration with anxiety, depression, and mood swings. You could also have wandering, right? You end up in a place that you don't know where you are or how you got there. You could have episodes of being aggressive where you normally weren't an aggressive person. You could also revert completely to be a recluse, meaning you want to stay by yourself. You don't want to be around anybody. Especially the recluse part usually happens in the middle to later stages. What are some of the effects on loved ones? So your family members often face emotional exhaustion, stress, financial burden. They become the caregiver. Seeing loved ones forget their identity or retreat emotionally can lead to significant grief even before death. So it's a condition that is very, very serious and really changes people. I'll tell you a story from me. I had a patient many, many years ago, over 20 years ago, actually. Very nice woman. It came on very fast for her. She would come in all the time. She would drive herself, and then we didn't see her for a few months. It was like maybe 3 or 4 months we didn't see it. And then she came back in, somebody drove her. Now, when she came in, we had always had great sales, great conversations and great talks. And she was a very interesting woman. And she actually sold Avon. She was selling Avon to the staff. Um, and this one time she came in, and instead of speaking English, she actually spoke Italian. Now, I don't speak Italian. Wish I did. I don't. But she was speaking to me in complete Italian sentences, and I've never heard her speak Italian. Now, she was born in Italy, and the person that was with her was her aide at the time, and she basically said to me that, well, actually, her son said it to me that she just switched one day and went from English to Italian, and she stopped talking in English. Everything was Italian. So something changed in her brain, and it completely changed her. Right? It was very difficult. I mean, difficult for me as somebody who's treated her for 10 plus years, and seeing this one type of person, then to see a totally different person. I can only imagine on what it does to the family. So it's very, very traumatic, and something that you really gotta use kid gloves, as they say, to try to help patients like this. So what are some of the causes of Alzheimer's and dementia? So again, dementia is a condition. It's a term using a whole bunch of different conditions, all resulting from problems with the brain. So when we think of dementia, we're going to think of it's going to impact memory, thinking, behavior, and the ability to perform your basic daily tasks. So you might hear me say a few different times similar information. I've pulled a lot of different sources, so sometimes there's going to be a little bit of an overlap. So that's okay. You might hear it twice. Maybe you'll learn it. The more you hear things, sometimes you learn it a little bit better. Okay, so let's get into the different types of dementia. So first, we'll talk Alzheimer's, because Alzheimer accounts for the majority of dementia. We already said that. It's 60 to 80% of the conditions. And it's typically caused from a buildup of abnormal proteins in and around the brain cells, typically amyloid plaque and tangles, which is what we talked about. And that's what led to cell death and tissue loss, which is brain shrinking. Vascular dementia. Now, vascular dementia occurs when blood flow to the brain, often with strokes or clot type conditions. It affects the blood vessels, damages the blood vessels, and causes a significant amount of flow changes. And that's what's going to be causing some of the cell death to that area. You could have another condition called Lewy body dementia. So that's caused by the accumulation of protein deposits called Lewy bodies in brain cells. It disrupts chemical signals and can lead to such conditions and symptoms as sleep problems, visual hallucinations, memory loss, and disorders that mimic Parkinson's. Another type of dementia is frontotemporal dementia. It's called FTD dementia. Typically, this arises due to degeneration of the frontal and temporal lobes of the brain. So the frontal is here, the temporals are on the side. And that can lead to changes in personality, behavior, and language. Typically affects language and behavior more dramatically than memory. Mixed dementia. In some individuals, multiple types of dementia can coexist. For example, you could have Alzheimer's and vascular dementia together. Some of the less common causes of dementia: Parkinson's disease. While Parkinson's disease primarily affects movement, it can progress to dementia in later stages. Huntington's disease. Huntington's disease is an inherited disorder that causes the nerve cells in the brain to break down over time, leading to dementia. Along with movement problems, it affects the brain in psychiatric type symptoms. Okay, you have another type called CJD. I'm gonna try to sell it. I'm gonna try to say this, so it might not come out right. Creutzfeldt-Jakob disease. It's a rare condition from misfolded proteins, prion, it's typically called prions disease, that severely affects brain function. HIV associated dementia. In advanced cases of HIV, the virus can lead to damage in the brain, causing dementia. So, other factors: head injuries, traumatic brain injury, especially repeated ones, like in athletes, whether you're playing football or rugby, anything where it's a contact sport, hockey, concussions to the head, they can increase dementia. Chronic alcoholism, excessive alcohol consumption over time may contribute to brain damage like dementia-like syndromes. Vitamin deficiencies, especially B12, can lead to reversible dementia-like symptoms. So if your levels get significantly low, you can affect your body in ways that you never thought possible. Thyroid disorder like hypothyroidism or other hormonal imbalances could mimic dementia-type symptoms. Okay, so now I really want to do is I want to jump into taking a little bit more of a deeper dive into Alzheimer's disease. So Alzheimer's is a progressive neurodegenerative disorder that typically impacts memory, thinking, behavior, and daily function. It causes multifacets of problems involving complex interplay between the biological, genetic, environmental, and lifestyle factors. We're going to go through a exploration of the major contributors to Alzheimer's disease development. So let's talk biological first. The amyloid plaques, typically one of the hallmarks of Alzheimer's. So basically, this is an accumulation of beta amyloid protein that are fragmented in the brain. The beta amyloid protein builds up and clumps together to form plaques between the neurons. So basically, you could think of it as, how do I want you to think about it? I want you to think about it as having my two hands are the neurons, and the space in between that normally has good flow is basically broken up, right? The connection has been altered. So instead of being here, maybe it's misaligned, or the plaque has clogged up the line so much. All right, so you can think of it like this. If you had a hose and you basically put a stopper in that hose and the flow wasn't getting through of water, that's basically what's happening with the neurons. So basically the plaque is interfering with the neural communication and therefore triggering an inflammatory process leading to neural death. So again, we're going to talk about the tau tangle. So tau is the protein involved in stabilizing microtubules within the brain cells. In Alzheimer's, the tau proteins become defective and develop into neural fibrillary tangles, which are called those tau tangles, disrupting the cell's transport system and leading to neural death. So it's basically the same thing, right? The same thing as the taus and the amyloid protein basically is the stoppage of communication between your cells, and therefore your cells die. Almost as if you think about it like this, if you ever had a Christmas light, right? You had a Christmas lights, and one of those lights go out, the whole entire string stops working. That's kind of what's happening, right? You're blocking flow, and that flow is causing that light to stop. Therefore, that light stops, and that host cell dies. That's basically what's happening. I'm trying to put it in terms that you all can understand, and this way it doesn't seem so medical. It's hard not to be medical though, because this is obviously a very medical condition, but I'm trying to give you some terms that I think can potentially understand what it is. Okay, so other biological causes, a synaptic dysfunction. So the amyloid plaque and the tangles impair the brain's ability to transmit signals between neurons. Over time, this results in reduced brain function and memory loss. You could also have a neuroinflammation. So chronic inflammation in the brain driven by overactive immune cells like microglia and astrocytes contribute to further damage. So as those cells are dying, your body's basically saying, hey, wait, there's a problem. Now it's trying to send your immune system to fix it, but it's not fixing it, it's actually making it worse. Brain shrinkage and atrophy. Alzheimer's disease leads to progressive shrinkage, atrophy of the brain, particularly in the areas of controlling memory and cognitive function, such areas as the hippocampus. Genetic factors. Let's talk about it. So first, that was all talking about biologicals. Now we're going to jump into genetic factors. APOE gene variation. So the APOE, which is the apolipoprotein E gene, plays a key role in Alzheimer's risk. People with the APOE4 variant are a significantly higher risk of developing Alzheimer's, as this gene variant may exacerbate the beta amyloid accumulation. The presence of one copy of the APOE4 increases the risk 3 times. 2 copies of it raises it 10 to 15 times. Very significant. You could have also another type of gene factor is gene mutation. So mutations in the gene, such as the APP, the amyloid precursor protein, or the PSEN1, which is the preselin 1 and the preselin 2, can cause early onset of familial Alzheimer's disease. So basically your genes, right? So these mutations are directly leading to overproduction of the beta amyloid. Family history. Individuals with a family history of Alzheimer's are at an increased risk due to shared genetic features and potentially shared environmental factors. Age as a factor. Aging effects. Age is the greatest known risk for Alzheimer's. As people age, the brain's ability to repair and maintain itself slows down, increasing the vulnerability. Declining cellular efficiency. So older brains accumulate damage from oxidative stress, inflammation, and other forms of cellular dysfunction, leading to progressive neurodegeneration. Brain changes over time. So by age 65 and older, the risk of Alzheimer's doubles every 5 years. After 85, almost 1 in 3 people are estimated to develop Alzheimer's. Now, I don't know why that's changed or what has possibly changed in us as people, or it's always been there, but we as a society are living longer, having better understandings of what testing. Don't forget, the advances in dementia and Alzheimer's has come leaps and bounds. Think about it in the, we'll say 70s. So the 70s was only 50 years ago. And the amount of information that we have now compared to then, it's miles and miles away, right? So we could have been, as people, having a lot of these conditions and just put it towards other conditions because we didn't understand the symptoms, right? We didn't have the information. We didn't have the testing to identify people with this condition. Plus, people are living longer now, right? The average age has gone up significantly, right? So we're living longer, so we're developing new, not new conditions, but conditions that we typically haven't seen as much. And that's because we got better testing, better diagnostics, better understanding, all of it. Okay, I digress. Sorry. Health and lifestyle related causes: cardiac and vascular health. Heart health significantly impairs brain health, right? So the amount of blood that's pumping obviously affects the amount of oxygen that's coming through our body. When you have decreased in your cardiac output, you're going to affect your organs, your brain. So conditions like hypertension, diabetes, high cholesterol, and obesity increase your risk for Alzheimer's. Reduced blood flow and oxygen supply to the brain exacerbate neural chain damage. Head trauma. A history of head trauma or injury or brain injury has been linked to increased risks of Alzheimer's later in life. Sleep disturbances. Chronic sleep deprivation or disturbances like sleep apnea can impair the brain's ability to clear the beta amyloid during rest periods. Dietary habits. Diets that are high in saturated fats, sugars, and processed foods are linked to increasing dementia risks. Antioxidant-rich diets, such as the Mediterranean diet, are associated with better cognitive function. Lack of physical activity. Sedentary lifestyles are associated with poor cardiovascular health and therefore brain health, which contribute to the risk of dementia. Environmental factors. So exposures to toxins, long-term exposures to neurotoxic substances like heavy metals, aluminum or lead, or pesticides may contribute to brain damage and Alzheimer's risk. Educational and cognitive engagements are also affected. So low levels of formal education have been linked to increased risk due to lower cognitive reserve. Cognitive reserve refers to the brain's ability to compensate for damage by using alternate neural pathways. All right. So what that's saying is when we're developing and we're young, the more your brain is developed because you're well read, because you're, we'll say, higher functioning, or your level of education, which caused your brain to keep thinking over and over again, actually plays a role. That is something I never even thought about or even heard before I did this deep dive, right? So that's something that is an interesting angle. Chronic inflammation and immunological factors. So chronic systemic inflammations from like autoimmune disorders or infections or obesity can profoundly affect the ability's brain health and Alzheimer's progression. Faulty immune system responses within the brain drive inflammation and speed up neural damage. What are some other risk factors? Like with most other conditions, smoking and alcohol, right? Smoking increases oxidative stress. Alcohol abuse is toxic to neurons, which may lead to Alzheimer's risk. Hormonal factors. Postmenopausal women show higher Alzheimer's risks due to changes in hormonal levels, particularly your estrogen decline. Chronic stress. Chronic stress elevates your cortisol level, contributing to inflammation. Therefore, they can impair your memory and cognitive decline. Okay, how does somebody get diagnosed with dementia or Alzheimer's? Typically, your neurologist, right? Typically, you're going to be seeing a neurologist for this. They're going to do obviously a deep dive into your assessing your symptoms, your family history, your your progression and changes in your memory. It really becomes with a lot of cognitive testing, a lot of mini mental exams. They have something called the MMSE exam, which gauge memory, language, skills. So there's a lot of cognitive studies out there and testing to really determine. So basically, a really good history, really good understanding of where you were to where you are, what are the changes. And the key is really to have your family members or yourself start writing things down so you understand where you are and where you were. This way you can give that information to your physicians so they can give you the proper evaluation. Imaging, MRIs and CT scans check for brain shrinkage or strokes, while the PET scans detect the amyloid plaque buildup. You could also have blood biomarkers. These are emerging tests that can detect proteins that are linked to Alzheimer's, allowing for early diagnosis. Treatment options. Let's go with some conservative, non-pharmacological options. Lifestyle changes, right? Healthy diet. We talked about this. The Mediterranean style diet with plenty of vegetables and omega-3s. Regular physical activities improve your blood flow and brain health, increase the oxygen levels. Social interactions, cognitive exercises like puzzles, slow progression. CBT therapy, cognitive behavioral therapy, to address any depression or anxiety. Any assistive technologies, apps, reminders, wearable devices, your watch. There's things you can wear around your neck. There's so many different new assistive technologies out there. Let's talk about some of the pharmacological treatments, right? So medications for Alzheimer's. The choline esterase inhibitors are meant to boost chemical communications in the brain, right? It's meant to bridge the gap between those neurons, right? So those clusters that form, it's meant to break those clusters or boost the communications through there. Memantine regulates glutamate, a chemical that is involved in learning and memory. Some of the emerging drugs out there, and we're going to get into this in a little bit later, is lecanemab, which targets the amyloid plaque to slow progression. There are some future therapies on the horizon. So some interesting stuff. There's some gene therapy that are targeting genetic mutations associated with early onset Alzheimer's. Stem cells. There's been research is exploring ways to regenerate damaged neurons. Stem cells are amazing, and the ability for these cells to transform patients' lives. I've seen it for myself, for my knees, and I've seen many patients for their knees, shoulders, and hips. Really changes their lives. And the amount of research that they're doing with stem cells, and whether it's kidney function, brain, it's just on the cusps of really getting out there. I think we're still several years away from really making significant advances to utilizing stem cells, but it's coming. It's coming. Vaccines. There are trials currently going on for vaccines that are aimed at amyloid and tau buildups. So some interesting stuff on the horizon. Hopefully it gets here faster. The faster the better, right? So like we said, by 2030, they expect to have 79 million people have this condition. So let's hopefully we have some of these before then. Let's talk about transforming Alzheimer's and dementia care, the key advancements in 2025. So right now, today. So 2025 has marked significant strides in the diagnosis, treatment, and management of Alzheimer's. As the global burden of these conditions continue to grow, groundbreaking developments are offering hope for patients, families, and healthcare providers. Let's go over some of the new advancements that are out there. With over 55 million people worldwide, the world is watching, and there are efforts to address the underdiagnosis cases in dementia and Alzheimer's. They've really intensified. So the non-invasive diagnostics, companies like Roche have developed novel, less invasive diagnostic techniques to enhance early detection and accuracy. Advanced biomarkers with utilizing fluid biomarkers, PET scans, and cerebral spinal fluid assays to lead to better tools for identifying and tracking the progression of Alzheimer's. Non-invasive screenings in development. Emerging diagnostic methods prioritize simplicity and accuracy for making early identification more accessible. What are some of the new drugs that are out there for 2025? So 2025 represents a watershed moment in Alzheimer's treatment with remarkable progress in both approved drugs and experimental therapies. Disease-modifying therapies. The FDA has granted traditional approval to lecanemab, LECANEMAB in 2023, and donanemab in 2024. These therapies are targeting the disease mechanism, potentially for slowing progression significantly. Next generation drugs. Clinical trials have brought forth drugs like some of these drug names. Remtitug, which is targeting the amyloid protein. Bunatentab, and semaglutides, which show promise in reducing cognitive decline. So there's been exploring beyond amyloid targets. So there's a shift in research that emphasizes disease pathways regarding the beta amyloid plaque addressing the Alzheimer's. There's some innovative drug development technologies where the researchers are leveraging cutting-edge tools to redefine drug efficiencies and explore uncharted therapeutic targets. So they are putting a lot of efforts out there and really trying to understand what's out there. So the non-pharmacological approach, in addition to the pharmacological advancements, innovative strategies are enhancing the quality of life for those affected. The Alzheimer's vaccine. So there's research into potential vaccine aiming to prevent or delay the onset. So the Alzheimer's vaccine is being worked on. It is not out there. So they are working on a potential vaccine for the Alzheimer's condition. What are some of the impacts and longevity and independent living with Alzheimer's? So breaking through in treatments are directly beneficial to patients and their caregivers, right? So finding that independent living, extending that independent living is what everybody's looking for, and they are working towards putting solutions out there. The broad landscape of this, together with the advancements, underscore a hopeful path in addressing Alzheimer's and dementia. From early diagnosing to groundbreaking treatments, the focus is shifting from symptom management to altering disease progression itself with new tools, therapies, and avenues. Research is on the rise. The future of dementia care is brighter than ever. And some closing thoughts. Dementia and Alzheimer's are more than just medical conditions. They redefine lives of millions, but advances in research along with care strategies offer hope for better outcomes and treatment pathways. By understanding the maze and mapping and piecing it all together, piece by piece, we can help patients and families navigate this difficult journey with grace, compassion, and resilience. So I would say this is one of the more difficult things for someone to see. And I'm sure it's more difficult for the person going through, right? I mean, no one wants to not know where they are, who their family members are. So I would say, as a society, we should be compassionate, be patient, right? Because even though they're going to probably lash out, and usually that's done out of not understanding, people change, and it is not their choice to change. Be patient, be compassionate, be graceful to them. Because as much as you don't want to see them go through it, they don't want to go through it. Let's, as a society, find that next solution. And as I always say, the information you heard here is my opinions and my opinions alone. They are not meant to be medical advice, medical treatment. Please see a physician if you have any one of these types of conditions, or if you're a family member, please get the right help. Please go see somebody. You might have to see multiple people to get the answers you need. Do your due diligence and really explore the ways to communicate with your loved ones and their conditions and maintain those meaningful bonds. Thank you for listening to Mind's Maze. If you heard anything here that can help somebody, please pass this along to them. If it's a family member, a friend, cousin, niece, nephew, neighbor, somebody you met in church, please pass it along. Maybe you can help them, give them a little bit more information about what's going on, what's out there. And as always, you got one shot at life. Be diligent, be smart, do your research, because your health matters. Till next time, I'm Dr. Chillemi. Be well, be safe.